I'm Raghu Kolluri from Columbus, Ohio. I am the System Medical Director for Vascular Medicine at OhioHealth Heart and Vascular. I am also the President for the Society for Vascular Medicine. I am going to talk today about the details of the network meta-analysis to compare VenaSeal with other superficial venous therapies for chronic venous insufficiency. Well, we all know that chronic venous insufficiency is one of the most common conditions we see in humans. Um, and it can affect as many as 40% of women and 17% of men. And there are a lot of therapies now that are approved for the elimination of reflux in the saphenous veins, which is one of the main causes for chronic venous insufficiency, apart from iliocaval obstructions, etc. So the purpose of this study is in the available market, if you would, of therapies available to eliminate reflux, including the thermals and the non-thermals. Thermals including the radiofrequency and laser ablation, and non-thermals including physician compounded sclerotherapy, microfoam, mechanical chemical ablation, and the cyanoacrylate treatments. Um, the there sometimes it's important to kind of step back and see what is the efficacy of um, a particular technique as compared to the other techniques. So the purpose of this study was to assess and compare the VenaSeal system specifically um, to the other treatment options that are out there in terms of its success rate to close the veins, and also to assess the um, patient-reported outcomes between various technologies as compared to VenaSeal system. So that is essentially the purpose of this study. So this is a network meta-analysis, which is comparison of multiple different techniques as they compare to each other. So initially, the meta-analysis sort of followed the PRISMA guidelines, which is the preferred reporting items for systemic reviews and meta-analysis guidelines. All different types of databases, such as uh, Embase, PubMed, Google Scholar, and all of those databases were searched for randomized controlled trials, because this is a systemic meta-analysis. We wanted only randomized controlled trials to be included. Were searched with keywords for chronic venous insufficiency and the therapies available for them. And I believe 63 publications were eventually extracted that met the inclusion criteria based on the PRISMA guidelines. Then Cochrane database, I'm sorry, the Cochrane bias tool was used to assess the publication bias, and they were kind of lumped into high risk, low risk, and unclear risk based on a scoring system that is again accepted generally. So the publications with minimum risk were included in this network meta-analysis, and it turned out to be 20 total studies that were included in the study. Now, when I say network meta-analysis, what it means is we're trying to compare multiple therapies to each other In the published paper, there is a figure 1B for reference. You could see that, for example, endovenous laser ablation was compared to sclerotherapy in 4 publications. It was compared to radiofrequency in 3 publications and to surgical therapies in 8 publications. So that is what the network model means. Then what we did is at that point, for the comparison, fixed effect model was used for the primary outcome, which is um, closure of the vein. So once we decided that we're going to use the fixed effects model, we analyzed it, and then we created rank probability graphs to assess each one of the effects. And we also created forest plots for each one of the parameters that we tested. The whole analysis was done within the Bayesian framework. In regards to the results, the primary outcome was closure of the vein. And when you look at the venous seal compared to the other treatment modalities, venous seal, fared the highest in the rank probability score compared to all other treatments. And second was radiofrequency ablation. Third was laser ablation, followed by surgery, and then sclerotherapy. Now, the secondary outcomes, which are essentially the patient-reported outcomes, such as VCSS scores, pain scores, AVVQ score, and E5QD scores. When you looked at these, venous seal ranked first in terms of the pain scores, but for the VCSS score, venous seal ranked third, and the AVVQ also venous seal ranked third, and the E5QD venous seal was fifth out of the 6. So again, to summarize, the primary outcome of closure venous seal was on the top. Pain scores in the secondary outcomes, venous seal was number 1, and for the rest, such as AVVQ and VCSS scores, venous seal ranked third, and the E5QD, the quality outcomes, venous seal ranked fifth out of the 6. Well, the conclusions basically, when in this particular meta-analysis, which included only randomized controlled trials, it basically shows that venous seal is a promising treatment, as superior anatomic success rate compared to the other technologies, again, in this meta-analysis. And uh, compared to other technologies, the adverse effects that were tested in this trial that included hyperpigmentation, bruising, pruritus, skin rash, DVT, thrombophlebitis, paresthesias, wound infection, some other infections, and pulmonary embolism. Venous seal ranked best in terms of the lowest adverse effects. Now, the viewers will ask about the hypersensitivity reactions, etc., that are reported from the venous seal as a technique itself. That is a very common question, and it is important to address that. Um, Whether we're talking within the framework of this meta-analysis or outside of the meta-analysis. it is important to remember that patients should be carefully selected when we perform procedures such as these. Um, we have to remember that those type of adverse effects were not reported in the randomized control trials that are included or that were included in this meta-analysis. So there's still that adverse effect of hypersensitivity reaction to the glue that is being reported as case reports, but that did not make into the meta-analysis because the meta-analysis included only randomized controlled trials. So overall, the procedure has, a very good anatomic success. It is a promising treatment, including in my practice for patients who are high risk for the adverse effects that I stated in this meta-analysis, um, but are low risk to have hypersensitivity reactions. It is a promising treatment. Again, as I said, the take-home messages are it is one of the tools that is available with high success rate and low pain scores because you're not using the tumescent anesthesia. It is useful in patients who don't have hypersensitivity to cyanoacrylate that especially has been previously reported by the patients themselves. It's useful tool in those elderly patients who have risk for ecchymosis, bruising, skin tears, and bleeding risk. And patients with phlebolymphodema who we worry that thermal ablations can worsen the lymphedema component of the phlebolymphodema. But again, like I said, appropriate selection of the procedures for patients is important. Technique should be tailored for each patient. And when I present the available options for the patients, I discuss all of the ups and downs and adverse effects and everything else, and then discuss then kind of empower the patient to make the decision of which procedure they want to pick.